Physical activity after childbirth. After childbirth, many mothers feel exhausted. Lack of sleep, body pain, fatigue linked to breastfeeding, household workload, worries about the baby, and sometimes loneliness. Some women also hear messages such as, "You must not move, you should rest for a long time," or "physical activity is not for women." Yet gentle, adapted, and gradual physical activity can become a real support during the first 12 months after birth, for the body, but also for well-being. An important point is that physical activity after childbirth has proven effects on mental health. A major scientific review showed that postpartum exercise reduces the severity of depressive and anxiety symptoms. Moreover, in trials where the intervention was based solely on exercise, the odds of postpartum depression were reduced by about 45% compared with no exercise. In other words, moving regularly, even in a simple way, can help protect a mother's mental health during a time of high vulnerability. The same study also indicates that starting early increases the benefits. Initiating physical activity before 12 weeks postpartum is associated with a greater reduction in depressive symptoms. In the Afghan reality, this does not mean returning too quickly to intense effort. Rather, once the midwife or doctor confirms that recovery is going well, and in the absence of warning signs, it is possible to start with short walks and gentle movements at home, then increase gradually. When to start, and what safety rules to follow. In the first days after childbirth, the body needs to heal. But healing does not always mean staying still. A slow walk at home, deeper breathing, and a few gentle movements of the legs and shoulders can already help circulation, energy, and mood. However, certain situations require medical advice before resuming or increasing activity. Very heavy bleeding that is getting worse, fever, severe pain, foul-smelling discharge, significant dizziness, shortness of breath at rest, chest pain, pain or swelling in one leg, or significant psychological distress such as dark thoughts or uncontrollable anxiety. In such cases, activity should not be forced. Medical or community support should be sought. The simple weekly goal: 80 minutes that matter. Researchers have tried to clarify the dose of activity needed to obtain a real mental health benefit. Their analysis indicates that at least a moderate reduction in postpartum depressive symptoms requires accumulating at least 350 minutes per week, which corresponds to about 80 minutes of moderate intensity activity. For example, brisk walking, water aerobics, stationary cycling, resistance training spread over at least 4 days per week represent approximately 350 minutes per week. In practical terms, this means aiming for about 20 minutes, 4 days per week. If 20 minutes feels too difficult at first, it can be split into 2 10-minute sessions during the day, then increased gradually. The most important element is consistency. A simple way to judge intensity: during moderate activity, it is possible to talk, but singing becomes difficult. The heart works a bit, without exhaustion. Which activities are realistic in everyday life in Afghanistan? The goal is not to go to a gym. The goal is to include safe and realistic movement, at home, in a courtyard, on a secured rooftop, in a quiet alley, or in a women-only space when available. Walking, main option. Walking is often the simplest, free, and most adaptable option. It can be done, in the courtyard or on a rooftop, if safety is ensured. In a hallway or a large room. Around the home, at calmer times. With the baby only if balance feels stable. Otherwise, it is better to ask a relative to watch the baby for 10 to 20 minutes. Pelvic floor exercises, essential after birth. After pregnancy, many women feel pelvic floor weakness, sometimes with urinary leakage. Pelvic floor exercises are discreet and can be done sitting or lying down. Example: gently contract the muscles as if trying to hold in urine. Hold for 3 seconds. Relax for 6 seconds. Repeat 8 to 12 times. This can be done 1 to 3 times per day. Gentle core strengthening, gentle abs. The abdomen needs gradual rehabilitation. At first, intense exercises should be avoided. Safer options include deep breathing, gently engaging the lower abdomen during exhalation, pelvic tilts while lying down, and slow controlled movements. After a cesarean section or in the presence of pain, progression should be even more cautious. Postnatal yoga and stretching. Postnatal yoga, or gentle stretching, can relieve the back, neck, and shoulders, which are often heavily strained during breastfeeding and carrying the baby. Scientific data mentions that several types of activity, including stretching and yoga, are associated with reduced postpartum depressive symptoms. Why can physical activity improve mood? Physical activity does not only act on the body. It can help rebuild confidence, reduce repetitive negative thoughts, improve sleep when possible, and restore a sense of control. Scientific study mentions possible psychosocial mechanisms, including improved self-esteem and self-efficacy, as well as shifting attention away from distressing thoughts. Example of a weekly plan: simple, adaptable. Goal: gradually reach 80 minutes or more of moderate activity over 4 days or more. A day: 10 minutes walking plus 5 minutes pelvic floor plus 5 minutes stretching. A day: 20 minutes walking, or 2 times 10 minutes. A day: 10 to 15 minutes walking plus 5 to 10 minutes gentle core exercises, breathing, lower ab engagement. A day: 20 minutes walking plus 5 minutes stretching or postnatal yoga. 8 other days, active rest, short walks at home, if possible. Over time, if recovery is going well, walking duration can increase up to 25 to 30 minutes. Or very light strengthening can be added. For example, standing up from a chair 8 to 10 times, slowly. The role of the group: support and motivation. When possible, being active with other women often helps. Motivation, social support, and feeling understood. In the Afghan context, group activity can remain very simple. Walking with a sister, a neighbor, a cousin, or doing a few stretches together at home. Cultural adaptations and safety. In some areas, going out alone can be difficult or dangerous. For this reason, the following options are especially suitable. A home-based activity: courtyard, secured rooftop, room in the home. A calmer times of day. A women-only spaces when they exist: clinic, association, enclosed schoolyard, etc. A involving the family to free up 20 minutes, baby care by the husband, mother-in-law, sister, neighbor. During the first 0 to 12 months after childbirth, a complicated program is not necessary. A simple and gradual plan can be enough. Start gently, ideally before 12 weeks postpartum, and aim for about 80 minutes of moderate intensity activity per week over at least 4 days. Walking, gentle strengthening, pelvic floor exercises, and postnatal yoga can help improve well-being and reduce the risk of postpartum depression as well as anxiety symptoms.